Picture this scenario. You're in the garage, maybe cleaning up a little spilled gasoline, or perhaps using some mineral oil or turpentine for a project.
Yeah, really common things found in so many homes.
Exactly. But what happens if your dog or cat, being the curious creatures they are, gets into it?
Except in a spill, maybe.
Or worse, gets it on their fur and then decides to, meticulously groom it off?
It's an everyday situation, really, that can quickly turn into a hidden, potentially serious danger for pets. Something maybe many owners just wouldn't even consider.
Exactly. Today, we're going to take a deep dive into this surprisingly complex threat: poisoning from petroleum hydrocarbons in our dogs and cats.
And we're not just, guessing here. We're guided by expert veterinary information that helps cut through the complexity of these substances and their effects.
Right. Our mission is to unpack exactly what these chemicals are, understand how they can harm pets, learn the specific signs to look for,
And most importantly,
figure out what you absolutely need to know and do, and just as critically, what not to do if you ever suspect exposure. We're sticking only to what our source material tells us here.
okay.
So let's dive right in. What are these petroleum hydrocarbons, or PHCs, that we're talking about, and why are they such a big deal?
Well, at their core, PHCs are a really diverse family of compounds. They're all derived from crude oil.
Okay.
We encounter them constantly. Fuels like gasoline, kerosene, various solvents, lubricants, even waxes. They're just, part of modern life.
And our source mentioned it's not just straight petroleum products, right? There are others that sort of act similarly.
That's a key point, yeah. Substances like turpentine and linseed oil, while not directly petroleum-derived, have toxicological properties similar enough that we group them together for this discussion.
But not everything.
No, we're specifically excluding things like halogenated hydrocarbons, think carbon tetrachloride.
Yep.
They behave quite differently.
Okay, so they're everywhere, derived from oil. But chemical isn't specific enough. What specifically makes them dangerous to pets?
It comes down less to just being a chemical and more to their physical properties. The source highlights three crucial ones: volatility, viscosity, and surface tension.
All right, let's break those down. Volatility.
Okay, think of volatility as how easily something evaporates, basically, how low its boiling point is.
Right.
More volatile products, like, say, gasoline or benzene, tend to be more readily absorbed systemically into the body. They're also more lipophilic, meaning they dissolve easily in fats.
Got it. And viscosity and surface tension. How do those two work together? This seems important.
It's absolutely critical, especially regarding the risk of aspiration.
Breathing it in.
Breathing the liquid into the lungs, yes. So viscosity is thickness. Think motor oil versus water. Surface tension is how much the liquid sort of sticks together and resists spreading.
Okay.
Products with low viscosity and low surface tension are the most dangerous if they get into the lungs,
Why is that?
because they can spread incredibly far and wet the tiny, delicate surfaces of the pulmonary airways. They just coat everything.
And here's where it gets really interesting. Our source gives this incredibly stark example. It takes hardly anything, right?
It truly emphasizes the danger of aspiration. Breathing these liquids into the lungs is the most acutely life-threatening effect. The source states that as little as 0.1 LOL
Wow.
of a low-viscosity hydrocarbon, something like hexane, aspirated into the lungs can cause severe pneumonitis that's acute inflammation of the lungs.
0.1 LOL. That's barely a drop. So it's really about the type of liquid and how it behaves if it gets into the airways.
Precisely. Compare that to a high-viscosity product like motor oil. That's certainly not good if ingested. But if aspirated, it's less likely to penetrate past the major airways simply because it's thicker.
Ah, right.
The danger of widespread severe pneumonitis from aspiration is much lower with those thicker liquids.
So the thin, runny ones that spread easily are the real aspiration villains here. Does the actual chemical formula matter beyond those physical properties?
Yes, definitely. The chemistry matters for systemic effects on the whole body.
How so?
Substances with higher aromatic content, like benzene, significantly increase the risk of toxicity throughout the body. Similarly, those with low molecular weight, like hexane again, are also linked to increased systemic toxicity risk.
Wow. So it's a complex interplay of how easily they become a vapor, how thick they are, how they spread, and their specific chemical structure. That makes a lot of sense why they're grouped together but have varied effects.
Exactly.
Now, how do our pets actually get exposed? It's not usually like they're deliberately drinking from a gas can, is it?
Well, okay, let's unpack this. It's often accidental, as you mentioned, but tragically, sometimes it's due to well-intentioned actions that actually cause harm.
Harmful actions. That sounds concerning. What do you mean?
The source details a few ways. Accidental spills that aren't cleaned up properly are common, or storing these substances in containers pets can easily get into.
Right, a leaky container, a drip on the garage floor. I can totally picture that.
Absolutely. But the source also points to historical practices, sometimes called folk remedies, where people would actually use things like gasoline or kerosene internally on animals
No. Why?
as a tonic, maybe, or to try and treat parasites. This is, of course, incredibly dangerous and a known cause of poisoning.
Oh, that's just heartbreaking to think someone might do that thinking they're helping.
It is. Another significant route, especially with cats, is when these substances are used to try and remove sticky things like tar or paint from an animal's coat.
Oh no. You'd think you're helping getting the gunk off, but then they're covered in a solvent.
Exactly. And cats are such fastidious groomers. If they get a hydrocarbon on their fur, their immediate instinct is to lick it off.
Which leads to ingestion.
Significant oral ingestion after topical contamination, yeah. The source points out that very small animals, like puppies and kittens, are especially vulnerable to topical absorption too,
Why them specifically?
because of their high body surface area compared to their mass. And long hair can trap the product against the skin, prolonging contact and absorption.
Okay, so accidental spills, improper storage, those dangerous remedies, and trying to clean pets with solvents. Those sound like the main ways pets get exposed.
That covers the most common scenarios, yes.
So once a pet is exposed, what happens inside their body? What are the main effects?
As we highlighted with that tiny 0.1 LLA example, the absolute primary danger is aspiration-induced pneumonitis.
The lung inflammation.
Right. If they breathe the liquid into their lungs, it directly damages the airway lining. It causes the small airways to constrict, that's bronchospasm,
Okay.
and it can actually displace the oxygen in the tiny air sacs, the alveoli. This leads to severe breathing difficulties and is the leading cause of death in these cases.
So the lungs are the major target and the most acute danger. What about other systems? Does it affect anything else?
Oh, yes. Beyond aspiration, simply inhaling high concentrations of vapors, say in an enclosed space, can suppress the lungs' immune defenses and also displace oxygen, leading to hypoxia.
And getting it on the skin.
Topical exposure to solvents like petroleum distillates or turpentine causes significant irritation. It can even lead to tissue necrosis, basically, skin and eye damage.
Does any of it get absorbed into the body from the skin or stomach? You mentioned systemic effects earlier.
Yes, systemic toxicity affecting the rest of the body is definitely possible. It can happen after oral ingestion or significant topical exposure, especially in small animals if large areas of skin are contaminated.
And it depends on the type again.
Right, the risk is higher with specific types of hydrocarbons, particularly those that are aromatic like benzene or low molecular weight like hexene.
Okay, so it's not just the lungs. It can really affect multiple systems.
That's right. The source lists effects on the respiratory system, obviously, but also nervous, gastrointestinal, skin, cardiac.
The heart.
Yes, and even potentially the hematopoietic system, the blood-forming system. Though the specific note about hemolytic anemia in the source was related to children, so we'll focus on the main effects seen in small animals.
Okay. Let's talk about what pet owners might actually notice then. What signs could indicate this kind of poisoning?
This is really important to understand. The signs alone are often not specific enough to make a diagnosis.
Ah,
The history, knowing there was a potential exposure, is absolutely essential for the vet to connect the dots.
so history is crucial. What kind of signs might that history help make sense of?
Well, if aspiration has occurred, you'll typically see respiratory signs appearing very quickly, usually within minutes to maybe an hour or two.
Like what?
Choking, coughing, gagging, difficulty breathing, that's called dyspnea. If it's severe, you might see hypoxia or cyanosis, that bluish tinge to the gums because of low oxygen.
And the source says this can get worse over time, right? It's not always immediate.
Yes, that's right. Respiratory involvement can worsen over the first 24 to 48 hours before it starts to gradually improve over the next 3 to 10 days.
Okay.
But crucially, this source highlights a really helpful point for owners. If an animal ingests a hydrocarbon and remains completely asymptomatic for 6 to 12 hours afterwards, they're very unlikely to develop significant respiratory illness from that ingestion. That specific time frame is a useful indicator.
That's a key piece of information for owners watching their pet after a suspected ingestion. Very useful. What might a vet notice on a physical exam?
Well, for the astute observer, there might be a characteristic hydrocarbon odor on the animal's breath or coat.
Ah, the smell test.
That's a really important clue if you're unsure about exposure.
Mm.
You might also see signs of pain or irritation around the mouth, like slobbering, champing their jaws, head shaking, maybe pawing at their muzzle.
Anything else?
A fever can develop hours after aspiration, sometimes within an hour, sometimes up to 24 hours later.
And what about GI signs if they swallowed it?
Vomiting is common, along with colic, belly pain or diarrhea.
Huh.
The severity really depends on how much was ingested and the type of hydrocarbon.
So like gasoline versus motor oil.
Exactly. Lighter products like gasoline tend to cause more vomiting and colic, while heavier ones like mineral oil might only cause mild diarrhea.
What about effects on the brain or nervous system? You mentioned that.
Right. Nervous system signs are quite common. You might see vertigo, ataxia, that's that wobbly, drunken sort of gait,
Mm-hmm.
mental confusion, depression, or a stupor-like state called narcosis. Less commonly, tremors and even convulsions have been reported.
Can it be fatal quickly?
While rare, the source mentions that very high doses could theoretically cause coma and death even before lung signs develop. But again, that's rare.
You mentioned the heart earlier too. What signs relate to that?
Hydrocarbons can make the heart muscle much more sensitive to catecholamines. Those are the body's stress hormones, like adrenaline.
Okay, so what does that cause?
This can trigger cardiac arrhythmias or irregular heartbeats and even cause syncope, which is fainting spells.
Fainting. Wow.
And what's fascinating here is that this heart sensitivity can persist for a day or two after the neurologic signs seem to resolve.
Really? Even if they seem better mentally?
Yes, it means the animal still needs careful handling and monitoring, even if they appear to be recovering mentally, because that sensitized heart is still a risk.
That's a really important point for ongoing care and definitely highlights why veterinary oversight is so vital. So if these signs aren't always specific, how do vets actually diagnose hydrocarbon poisoning?
Yeah, that raises an important question. How do you confirm it? As we've stressed, the most crucial piece of information is the history. Was there a possible exposure?
Right, the context.
Without that context, the signs alone could point to many other issues.
So the history helps narrow it down significantly. What else helps confirm it?
The physical exam, especially checking for that telltale odor, is a major clue.
Okay.
The source also mentions a simple test vets can do, mixing vomitus or stomach contents with warm water.
And what does that show?
If hydrocarbons are present, they'll often float, have that characteristic smell, and evaporate quickly on something like a paper towel, unlike normal dietary fats.
Huh. That's a clever, simple test. What about imaging, like x-rays?
Radiographs, X-rays of the chest, are very valuable if aspiration is suspected. They typically show signs of aspiration pneumonia, often concentrated in the lower ventral parts of the lungs.
When do those show up best?
These changes are usually most severe around 3 to 4 days after exposure and then gradually improve. Although, interestingly, the radiographic signs what you see on the X-ray can often linger longer than the pet's actual clinical signs. They might look better before the X-ray looks totally clear.
And blood work or other lab tests, are they helpful?
Routine lab tests like blood counts or urinalysis are mainly useful for ruling out other potential problems that might have similar signs, like, say, antifreeze poisoning.
Okay.
Chemical analysis of stomach contents or tissue is possible, but it's really more for forensic investigation, like after death, rather than for immediate clinical decision-making.
Okay, so history, exam, maybe that simple water test, and x-rays are the key diagnostic tools. Now let's get to the absolutely critical part. Treatment and management. What should someone do, and just as important, what should they not do if they suspect their pet has been exposed?
The absolute primary goal, in any case of uncomplicated ingestion, meaning the substance isn't also mixed with something else highly toxic, is to minimize the risk of aspiration. That is the #1 priority.
Minimize aspiration risk.
Right.
Got it. So what are the first steps a vet might take?
Well, it depends. If a pet has only ingested a small amount of a less volatile, more viscous product, think motor oil or grease, sometimes simple cage rest and observation is enough.
Okay.
However, if it's a substantial volume of something known for systemic toxicity, like gasoline, giving activated charcoal within the first 4 to 6 hours might be recommended to help absorb it from the gut.
What about trying to get it out of the stomach, like
Yeah.
making them vomit or pumping the stomach?
This is where it's absolutely vital to follow professional advice and not try things at home. Gastric decontamination methods like stomach flushing, which is called lavage,
Yeah.
are generally not beneficial after about 60 minutes post-ingestion.
Yeah.
And inducing vomiting using emetics is generally contraindicated.
Wait, contraindicated? That seems totally counterintuitive. Why wouldn't you want to get the poison out?
because of the extremely high risk of the pet aspirating liquid while they are vomiting. Remember how easily those low viscosity liquids spread in the lungs?
Ah, right. Vomiting makes aspiration much more likely.
Exactly. The source is very clear. Emetics should only be considered as an absolute last resort, and only if the product contains other substances that are even more toxic than the hydrocarbon itself, like some pesticides mixed in.
And even then,
Even then, extreme precautions, like placing a tube into the tracheal intubation to protect the airway, are absolutely essential to prevent aspiration of vomited material.
so bottom line, this is not something you should ever attempt yourself at home. Call the vet immediately and understand that inducing vomiting is highly risky and rarely recommended by professionals for just hydrocarbon exposure.
Precisely. Immediate veterinary consultation is key, and they will guide you on what, if anything, should be done regarding emptying the stomach.
Okay, what if aspiration has already happened? How do they treat the lung damage?
That requires symptomatic and supportive care. Supplemental oxygen is often needed.
And if it's really severe?
In severe cases, mechanical ventilation might be necessary. The source notes that conventional positive pressure ventilation requires caution due to risks, like lung collapse or pneumothorax. It suggests high-frequency jet ventilation might have fewer complications.
Any other considerations for ventilation?
Yeah, since volatile hydrocarbons are actually eliminated partly through the lungs, the ventilation system needs frequent purging to get rid of those vapors.
Makes sense. What about cleaning topical exposure, like if they got tar or paint remover on their fur? How do you handle that safely?
Gently bathing the animal with warm water and a mild detergent shampoo is the recommended approach.
What if it's really matted in?
You might need to clip away heavily contaminated or matted fur. If there are actual petroleum burns on the skin, those are treated symptomatically, maybe with topical antibacterials.
And for really sticky stuff like tar?
The source does add that very thick substances like tar or waxes aren't readily absorbed through the skin, so removing them is often more for cosmetic reasons or preventing skin irritation than preventing systemic toxicity.
And you mentioned earlier that using solvents on the pet to clean them is a bad idea, a cause of exposure. So what should you use if your pet gets something really sticky, like tar, on their fur?
Right, instead of harsh solvents, the source suggests lipophilic materials. Things that dissolve fats like butter, lard, or even mechanic's hand cleaner can be helpful for loosening sticky substances.
Oh, okay. Butter or lard. Interesting.
But solvents are explicitly not recommended for cleaning an animal directly.
Good alternative suggestions there. Any specific nursing care needed during recovery?
Cage rest is important. It aids healing, especially for the lungs, and it also helps minimize excitement. Remember that sensitized heart muscle.
Right, the catecholamines.
Exactly. Minimizing stress reduces the release of those hormones that might trigger arrhythmias.
You mentioned some medications are bad ideas earlier. What about things like antibiotics or steroids? Are they ever used?
Okay, so antibiotics for the initial chemical pneumonitis are questionable. It's not primarily a bacterial infection at first.
But
However, if the animal has vomited, there's a higher risk of secondary bacterial infection getting into the damaged lungs. So prophylactic antibiotics may be considered prudent in those specific cases where vomiting occurs.
and steroids, like cortisone.
Corticosteroids are contraindicated. Studies have shown they're actually associated with an increased chance of finding bacteria in the lungs later on, so definitely not helpful, potentially harmful.
Okay, so no steroids. What if they have that bronchospasm, the airway constriction?
If the pet is experiencing bronchospasm, they might use medications like beta-adrenergic agonists, such as albuterol, to help open the airways.
Got it. So just to recap the big no-nos for owners. Inducing vomiting is usually out. Giving mineral oil or vegetable oil is actually bad, according to the source, as it increases aspiration risk.
That's a key one. Historically recommended, but now known to be detrimental.
And steroids are contraindicated. Okay. What does follow-up and the general prognosis look like for these cases?
Pets should typically be monitored closely for at least 3 to 4 days after exposure. This helps ensure anything ingested has cleared the gut and allows vets to catch any delayed lung issues.
And generally, what's the expected recovery course, assuming they get appropriate care?
It's hard to give a single prognosis because the products involved are so variable, but the source indicates that most hydrocarbon exposures respond well to supportive conservative therapy.
So good outcomes are possible?
Yes. Respiratory signs usually improve over several days, but remember, those radiographic changes on the x-rays, they can last longer than the clinical signs.
And the heart?
Right, need to keep monitoring for that cardiac sensitivity even after the neurological effects seem to clear up. Continued caution is needed for a couple of days.
That paints a clearer picture of the potential recovery timeline. Okay, so we've really taken a deep dive today into the potential dangers of petroleum hydrocarbons for our pets,
Yeah, covering everything from common household spills and grooming habits.
to how different physical properties like volatility and viscosity drastically change the risk, particularly that critical risk of aspiration.
We've definitely underscored that aspiration is the most immediate life threat, and that having a history of exposure is absolutely vital for diagnosis because the signs alone often aren't unique.
And we hit those crucial don'ts that some seemingly logical steps, like trying to make your pet vomit or giving them oils, are actually quite dangerous in this specific scenario.
Right.
Recognizing subtle signs, including that characteristic odor, and understanding key time windows, like that 6 to 12-hour window after ingestion for respiratory signs, are important takeaways for you as a pet owner.
Absolutely. Understanding these specific risks empowers you to be more cautious at home and store these substances safely.
Very important.
And know the absolutely critical first step, if exposure happens, contact your veterinarian immediately, and what actions not to take unless specifically instructed by them.
So, wrapping up, what does this all mean?
Well, considering how common these substances are in our daily lives, often right under our noses in garages, sheds, even under the kitchen sink sometimes,
Yeah.
and how potentially subtle the initial signs can be, this deep dive really highlights just how important constant awareness and quick, informed action are when it comes to protecting our animal companions from these kinds of unexpected household hazards.